My name is Rhiannon. I came to the Breathe Institute a little over 3 months ago. I was having a lot of issues with my sleeping, breathing, a lot of jaw discomfort. I was getting headaches probably 3 to 4 times a week. I was getting a lot of tension and stress in my neck, my shoulders, waking up multiple times a night, anywhere from 5 to 7 times a night. I was told that I was snoring while I was on my back. And I did actually find out that I was snoring in every position that I was sleeping in. All of these issues that I was having with my breathing and my sleeping really just started to have a triple effect on my every day-to-day life as a mom, as an employee, as a daughter. I was constantly waking up feeling very fatigued. I was exhausted throughout the day. I felt like I was either having headaches from being so exhausted, or I was having headaches from all of the tension and discomfort that I was getting in my jaw. And it was really just becoming a struggle for me on a consistent, everyday basis.
Hi everyone, I am super excited to start this new journey. I am on this orofacial myofunctional therapy journey. I will be taking you guys all on this journey with me, and I hope that at least one person, if not a few, are able to get something out of this, to have this life-changing experience for yourself as well.
Hi, Dr. Zaghi. We're ready for your next patient.
I'm Dr. Zaghi. It's really nice to meet you.
You as well.
Thank you so much for coming in. We just reviewed your CT scan and all the history that you provided. Thank you so much for taking time to do that. And we're here to talk more about the tongue and lip tie, as well as your sleep and breathing issues. Say mild tonsil hypertrophy. Lift up your tongue for me. Good, up to the front of your teeth. And we're gonna get a closer look, but this does look like a posterior tongue tie. And I'm gonna put my finger in your ears and ask you to open and close. Open. Good, and close. And I feel some popping there, isn't that right?
Yes.
Okay, we see that you have this posterior tongue tie. Lift up your tongue. All right, and we see the dimple posteriorly and the cupping on this dorsal surface of the tongue. Lift up the tongue. And that reflects the posterior tongue tie right here in the mid-body of the tongue. Taking a look at the upper lip, I'm not too concerned. Right here is the nasal spine, and it doesn't feel very tight here. It sounds like you have positional sleep issues, which is oftentimes consistent with low tongue posture, so that when you're sleeping on your back, the tongue is slowly falling back and blocking your breathing. So the sleep study is really going to be helpful for us in terms of treatment planning and sequencing more in the long term.
Okay.
In any case, I think it'd be great for you to start the myofunctional therapy and learn a little bit more about our lingual frenuloplasty protocol. I'm going to give you some time with Amanda, who's going to tell you more about that.
Yeah, so myofunctional therapy, we actually have all of our patients that go through the lingual frenuloplasty pair with one of our amazing therapists, or we also have a wide range of amazing providers that we work with outside of our office.
We're going to do a procedure for you called the lingual frenuloplasty.
Okay.
This procedure is under local anesthesia while you're wide awake. We put topical anesthetic on the tongue, give a small injection to that area, and then use a combination of laser and scissors to complete the release. Well, thank you so much for coming.
You.
We'll take the very best of care.
Thank you.
I am super excited to start this journey, get my procedure done by Dr. Zaghi. I just really have a feeling that this is going to be so completely life-changing for me. I will meet with my myofunctional therapist every week. This is going to be my journey for the next probably couple of months, and I am super excited about this procedure. I can't even tell you guys how excited I am to have this done.
I'm Leslie Kupiak, and I'm a myofunctional therapist with the Breathe Institute. And I had the pleasure of working with Rhiannon for her pre and post frenuloplasty myofunctional therapy. And she was a really motivated and dedicated student, which is really important when it comes to maximizing patient outcomes. At our initial session, we always look to recognize any potential dysfunction and from there create goals for our patients. One of the main things we do is look for potential compensations. There are 5 major compensations that we look to assess, being floor of mouth elevation, facial grimace, neck engagement, jaw protrusion, and jaw lateralization. I will say Rhiannon did present with all 5 of those compensations when she first came in to see us. However, her jaw compensations and the floor of mouth elevation, she was able to eliminate rather quickly. But her facial grimace and neck engagement, those 2 compensations were a little bit more ingrained, and she would kind of default back to those if she wasn't, really focused and paying attention when she was doing her exercises. So our job as myofunctional therapists is to recognize, coach, motivate patients to really understand the therapy and their treatment, and really help them maximize their efforts when they are working and doing the exercises and stretches on their own. We also work to recognize when a patient may need additional support from other providers. So we're really looking at an interdisciplinary approach. For example, bringing in a PT for helping with posture and things like that that may be out of a myofunctional therapist scope.
What we want to do is kind of relax that tongue and that lower lip. Okay. And then you want your fingers, your hands to be doing the stretching. So you're going to take the gauze. Okay. And then I'm basically pulling about straight out, but sometimes I'll like lift it or you just move it around until I find like that best stretch. But really try to relax the shoulders, so you don't want to be like tense. You want to just let everything relax and give a good stretch. We're going to hold it for about 15 seconds. Very good. Then we're going to pick a side. So, great. Other side. And again, relax the face, relax the shoulders. Good. Perfect. So that is your tongue pull stretch. So next stretch I'm going to teach you is, I call it the forklift stretch. Basically, we're either going to use fingers, kind of like Charlie's Angels, or we're going to use our thumbs. But what we're trying to do, if we have the tongue and the floor of the mouth here, we're trying to get back underneath. Okay. So we kind of suction up to get in place. Then we relax the tongue into puppy and lift that back part of the tongue. So we're trying to feel the stretch more toward the back of the tongue versus the front, the frenum. So if I were to suction up, fingers, it's easier to come downward on. So suction up, get those fingers in place, back as far as you can. Then once they're in place, relax it, and then try to give a little lift and hold it for about 15. Good, how'd you feel?
It feels funny.
Okay. And feeling it more toward the back though than the front?
I kind of feel like it's like the sides of the back of the tongue come up.
Perfect.
Okay.
So that is your forklift stretch. Okay. The next one, I call it like a J sweep, because we're kind of sweeping the floor of the mouth up the back side of the tongue, kind of making a J motion with our finger here. Okay. You can either do it opposite hand, opposite side, or same hand, same side, whichever one you get a better stretch. I'll show you both ways. But basically, again, for the back of the tongue, we want to go down like by that last tooth if you can, in the lower jaw, sweep down in the floor of the mouth and up the back side of the tongue. And kind of pull and hold away for about 2 to 3 seconds and repeat. So instead of doing 15 seconds, we're going to do 10 total each side.
Okay. I wanted to ask you, do you want me to reset between each stretch or just get it in there, stretch, go down, back up?
Okay, so for J sweep, yes, you're, instead of like where we were just holding 2 rounds of 15 seconds for J sweep, we're repeating it. So it's a little quicker. I usually hold it for about like 2 to 3 seconds, maybe, just to like get that good stretch. But that repetitive motion is going to help to really get the floor of the mouth and stretch that back side of the tongue.
So start here, and I want to see like the wrist kind of start up and then be facing in when you're done. So really get that wrist flip. So flip it the other way first. Yep. And then, yep. And then you're going to come inward. So the palm then faces in as you're done. There you go. Perfect. All right. Excellent. So any questions on those stretches? No. Okay.
So once a patient has minimized their compensations and we've worked to strengthen and balance the muscles of that orofacial complex, a patient is then able to go ahead and schedule that functional frenuloplasty. And I always like to ensure that they see me for myofunctional therapy at least about 2 to 3 weeks prior to that surgical date, so that we can teach them their manual stretching. And that also gives them enough time to really practice these pre and post-operative stretches prior to their procedure. The manual stretching really is such a critical component into optimizing the results of the procedure and their myofunctional therapy going forward. There are multiple benefits to these stretches. Some of those include helping with muscle relaxation in the tongue and the floor of the mouth, helping to loosen and realign any connective tissue in that orofacial complex. It's also really helpful in helping the body to reorganize during and after that surgical procedure itself. So This, in addition to, again, maximizing the range of motion, minimizing that contraction that normally happens during wound healing, manual stretches are really, really important.
All right. Hi, Rhiannon. Welcome back. Welcome back. We're here for your frenuloplasty procedure day. Do you have any questions before we begin?
Nope.
All right. Say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Oh my God. All right, high five. 10 out of 10. Woo. All right, let's show you what it looks like.
Oh, wow.
How do you feel?
I feel good.
Good. So
Thank
good.
you.
So happy for you. Happy recovery. Thanks, everyone. Let's welcome Rhiannon to the Hall of Fame. Congratulations, Rhiannon. Such a brave person.
So I am 2 days post-op, feeling actually very good today. I think the hardest part for me, or the most uncomfortable that I was right after the numbing started to wear off, the day of the procedure, and of course the morning after the procedure. Morning after the procedure, when I woke up, I felt like I was really tight in the floor of my mouth, but it's only because of the inflammation and the swelling. But I was able to, yesterday, I was able to eat a little bit more than just mush. I had some drunken noodles, Thai noodles, which were pretty soft. In there, I had tofu, some soft carrots, and I was able to chew through those pretty good, get them down. Only thing I noticed is during, the swallowing or trying to move the food around in my mouth to swallow it, is a little sensitive on the tongue. Today I was able to eat more solid foods. I had salmon, mashed potatoes, and some chicken noodle soup. There were some big chunks of the chicken in there. Kind of just cut them up a little bit better and was able to chew and swallow no problem. So all in all, post-procedure wise, I feel like I'm doing really good. Not really feeling any pain, a little discomfort, of course, still in the floor of my mouth, and of course, from the stitches, like the incision part, but actually feels very good. Procedure for me was seamless. It was absolutely amazing. I didn't even feel a thing when Dr. Zaghi stuck the needle in to numb my tongue. And I did notice that as soon as he released that genioglossus muscle, I felt so much lighter. My body just felt at ease and rest. I feel like there was so much tension that lifted from my shoulders, my neck, my jaw. So overall, I feel this was something that I definitely should have done a long time ago. Definitely something that I needed. The last 2 nights, I've noticed that I have slept so much better. First night, obviously not as good because I did have some discomfort from the tongue, which did wake me up, but it was only one time. Last night I slept, I didn't wake up at all. So I'm very happy with the procedure and post-op so far at this point. I will continue to keep all of you guys updated. So I am a little over 2 weeks post-op from having my lingual frenuloplasty done with Dr. Zaghi. I have noticed a significant difference in my sleep. I used to wake up about 4 to 5 times a night to go to the restroom. I would toss and turn all night. Noticing in the mornings that I am waking up feeling very refreshed, significantly less fatigued. I'm sleeping solid throughout the entire night, which is amazing. I can't even tell you. I've noticed I have less tension in my jaw, my neck, and my shoulders, if any at all. I've noticed that I have actually not had a headache in the last 2 weeks, which is huge for me because I would get probably 3 to 4 times a week at minimum. Do notice that some days I do still get a little bit of the contraction from in the wound area, in the tongue. But I'm noticing that once I do my myofunctional therapy exercises, that contraction does go away and loosens again. So the myofunctional therapy is absolutely helping. So I am definitely looking forward to seeing what my sleep study will show as far as my sleep apnea goes. Going to be doing that about 2 months post-op. So very excited to see what those results are going to be. So I'm definitely super grateful to Dr. Zoggy and the whole Breathe Institute for this entire process and really just changing my life.
Hi, Rhiannon. How are you?
Dr. Zoggy, I'm doing great. How are you?
Great to see you. Welcome back. Welcome back.
Thank you.
It's now been about 2 months since your procedure. Is that
Yes.
right? Very, very good. How's everything going?
Amazing.
I'm so happy to hear that. Tell me what's going on.
My sleep quality is so much better. I'm not waking up. I used to wake up probably 6 to 7 times a night to go to the restroom. I'm not doing that anymore.
Oh my
I'm
gosh.
feeling very, very rested. Waking up in the morning. The tension from my shoulders, my neck, my jaw is gone. Headaches have decreased significantly. It's amazing.
Amazing, amazing. I'm so happy to hear that. Let's take a look.
Okay.
Like, open up your mouth for me. Lift up your tongue. Excellent. Looks fantastic. Really nicely healed. Go ahead and do the suction hold of the cave. Fantastic. Fantastic. Looks amazing. Let's check the floor of mouth hold. Open up your mouth all the way. Lift your tongue up. Fantastic. Looks great. Looks great. What are your thoughts on the whole process, and what advice do you have to anyone who may be considering this procedure?
Advice for someone considering the procedure is definitely to stay very diligent with the myotherapy sessions. I made sure that every day was 3 to 4 times a day with my exercises pre-procedure. Post-procedure, I think it was for the first month was still 3 to 4, and then this last month has been down to 2 to 3 times a month. But I think the therapy is very important in tongue posture, tongue strength, just overall everything.
Amazing, amazing. I'm so happy to hear that. Now tell me, do you think it makes a difference if you just have like a list of exercises to go through, or do you feel like actually seeing somebody once a week to really customize it was beneficial in your
I
case?
definitely feel like seeing somebody once a week is beneficial, just to make sure that you're doing the exercises properly, and being able to see them do the exercises helps you as well.
Amazing, amazing, amazing. Really, really good. Thank you so much for participating. Any last words?
Thank you. No, I just want to thank you and everybody here. I mean, this for me has been so life-changing. Just a simple procedure that can completely change your life.
Absolutely.
So I thank
absolutely.
you.